As Lolita said, I'm Nicole Kayode, and I'm the founder of Medixus. We are connecting Africa's medical community. So on the continent, we've got a problem, and that problem is brain drain of our medical personnel. So we've got a deficit of 2.4 million healthcare workers, and it's getting worse by the day. That leads to the doctors that remain having limited physical peer support networks, and those that leave cite lack of support and mentorship as the third most common reason for leaving the continent. So this becomes a self-fulfilling cycle. Doctors leave, your peer network gets smaller and smaller. And the best example I have to illustrate this is that in 2015, in the Kenyan province of Lamu, 5 doctors resigned, and that left 1 doctor responsible for 100,000 citizens. So where does she turn to when she needs support, when she's not sure how to proceed with a patient case? Currently, her options are guess and hope for the best, refer a patient to travel into the city for a trip they might not be able to afford to make and care they might not be able to afford to pay for once they get there, or connect to the truly Pan-African medical community that we're building. So the idea is that we want no doctor to ever be faced with that choice again, because it's not a good feeling to know that you're guessing. So what we want to do is put the knowledge of every doctor in the continent in the pocket of every doctor in the continent. So we do this through a very simple mobile app, which allows them to share knowledge which is relevant to local disease burdens, local treatment pathways, and the changing patterns, as well as receive peer support and reduce that sense of professional isolation. So it doesn't matter if you're the only doctor within miles, you can still connect with your peers in real time. And ultimately, save lives through improved quality of care, empowering them to make better clinical decisions, and ultimately empowering the patients. So it's a very simple process. You simply upload a case into the app. You view a case feed where all your cases are coded by specialty, so it makes it really easy to find what you're looking for. And you can create a profile so people know who you are and where they can find you. So currently, people are using things like Facebook and WhatsApp. I'm in a lot of the Facebook groups, and I'm not a qualified medical doctor, so there's a clue about why that doesn't work. WhatsApp, you've got it's a wonderful tool, but then people post pictures of their cat, someone sends a prayer, then you see something about someone's kid doing something cool at school, and then you struggle to find what you were looking for. So we think Medixus helps cut all that noise out and helps people focus on what's really important, which is the cases. The market size is huge. So across the world, there are 43 million healthcare workers. In Africa, there's 1.8 million. And across Kenya, which is where we're starting, there are 62,000. And as I mentioned, although we're starting in Kenya, this is a global problem. Some of you maybe are from America, where you'd know if you're in a rural part of the States, the quality of care you get versus being in metropolitan New York is very different. So our business model is very straightforward. We've got an enterprise product, which is paid for subscription-based by hospitals and government bodies. And we also have a freemium product, which is direct to the doctors and will always stay free for individual users because we want to keep the barrier to access low. We have 200 doctors registered to date, which equates to about 2.6% of all Kenyan doctors. And that's in under a year of us being on the market. And I'm excited to say that as of last week, I literally just came back from Kenya with the contracts. We've signed one of the largest hospital groups in East Africa, and we're starting with just one of their flagship sites, which will bring us an additional 345 doctors. And they have 375 medical facilities across East Africa and Pakistan. So our team is a wonderful bunch. Obviously, there's myself, my co-founder Rita, who, she hates me saying this, but I say it every time, has over 20 years development experience. She thinks it reveals her age, but there you go. And between us, we've got experience of 3 medical doctors. Our clinical business development lead, Jean, also has a master's in public health. And you're not seeing double. Those girls who see me rehearse this have heard this joke about 10 times, but I'm doing it again. You're not seeing double. That is my big sister, who's also a doctor. So our plan here really is to create meaningful, frictionless connections between the global medical community. And what I mean by that is not just through a platform, but what we're trying to do is empower doctors to feel confident in their decision-making, empower patients to trust the care they're getting, and also receive a higher quality of care. Because currently we're losing billions on the continent in lost tourism, medical tourism costs where people travel abroad because they don't trust the quality of care they're getting. So ultimately, one day we'll be able to integrate artificial intelligence, increase accessibility through SMS-based access and USSD support, and also predictive recommendations. So eventually, you don't even have to wait for a human to respond. We can suggest what the causes might be before you even have to question it. So yes, as I said, we're Medixus, and we are trying to change the face of healthcare, starting in Africa, but hopefully globally. And if you would like to join us, then please come and speak to me at the end if you're interested in partnering, if you're a hospital group or adjacent to any medical facilities, or if you're just a particularly rich person who has some money to throw away. We're always looking for cash. So thank you.